Hello everyone, it's Monday, June 1st. I'm Rendi Murphree, Epidemiologist and Director of Disease Surveillance and Environmental Services at the Mobile County Health Department, here to give you our daily COVID-19 update as the pandemic affects our world, nation, state, and lovely county. Worldwide, there have been just over 6.2 million cases of COVID-19 reported, with 370,000 deaths. In the U.S., around 1.8 million COVID-19 cases with about 105,000 deaths. In Alabama today, the dashboard was reporting around 118,000 confirmed cases and 288 probable cases, with 646 deaths. If you've been looking closely at the dashboards every day, you will notice that the Alabama Department of Public Health published a new version of their COVID-19 dashboard, a much different look than we've been used to over the past 2.5 months. A couple other changes, so check that out. If you want to look at the data specific to Mobile County, there is a button in the upper right hand corner, a drop down menu in the far upper right corner of the new dashboard, where you can select the county, and then you will get the number of cases and hospitalizations and deaths for the county there, and maybe some additional information that is now provided there by county that had not previously been reported. So please check that out. So the dashboard is new. Also new is the reporting of confirmed and probable cases separately. Before today, we had been combining confirmed and probable COVID-19 cases and referring to them as COVID-19 disease. And starting today, Alabama and Mobile County Health Department have begun reporting those as separate numbers, because the Centers for Disease Control also previously had been combining those two into one count, and today CDC has started reporting confirmed and probable cases. So let me just read you the difference between a confirmed and probable case. Basically, confirmed means it's laboratory confirmed. The total number of patients with laboratory confirmation of SARS-CoV-2, the virus causing COVID-19. Confirmed deaths have a laboratory confirmation of SARS-CoV-2. So either disease or death with laboratory confirmed SARS-CoV-2, the virus that causes COVID-19 disease. For probable cases, it's a little bit more lengthy. So for probable cases, they're epidemiologically linked, which means you had close contact within 6 feet for 15 minutes or more with a laboratory confirmed case, and you have symptoms of COVID-19, but you have no confirmation by laboratory testing for SARS-CoV-2. So basically, for a probable case, you have known exposure to a laboratory confirmed case, you have symptoms of COVID disease, but you have no laboratory confirmation. That's a probable case. And for deaths, it's basically if they have no, COVID-19 is noted on the death certificate, but there is no confirmation using a laboratory result for SARS-CoV-2. So that is the difference between confirmed and probable case. And again, we, the state, and CDC had all been reporting those as a combined one number, as we think of them as the same, both populations having COVID disease, but we began reporting that out separately today in line with CDC and ADPH. So our daily report also has experienced a great change over the weekend. So the first page actually will be the only page that gets updated daily. This is the only page that we will update every day. The remaining pages, and we'll talk a little bit about them, will be updated once a week, and you will have that available on Monday. It will be a description of data reported to us through the previous Saturday. So today we're reporting the weekly data for data that was reported to us for the week ending this past Saturday. This is a system that CDC has followed for many decades for sort of considering a week as Sunday through Saturday. So today we are reporting on 2,253 cases of COVID-19 disease. 2,244 of those are laboratory confirmed, and only 9 were classified as a probable case of disease. We're sticking around 11% of our cases have been hospitalized at some point in their illness, and 5.2% have died with COVID-19 disease. Over the weekend, we saw a smaller number of cases reported daily than we had been seeing in the previous weeks. So on the column chart that provides the number just on the last 2 weeks so that you have more resolution and can see those. Yesterday, Sunday, 30 cases reported, Saturday 38, Friday 42, Thursday 33. So that is a slightly smaller number per day than we had been seeing in previous weeks. I'm a little concerned that that might be an artificial reduction in the number of COVID positive cases because of the effect of the holiday. So in addition to Saturday and Sunday, we know that testing drops way down on the weekends. So I expect that that smaller number of cases reported to us last week had to do with there also being a holiday on Monday where most places were closed and people were really not wanting to go out and get a COVID test on their holiday, their 3-day holiday. So we'll see how that goes. For many of the first state offices today, they are closed today for a state holiday, and I believe the county offices may be closed too, but we're working. So, all right, so of the weekly reports that we are going to begin providing, again, this is our patient demographics. So things by age and sex and race have not changed much. We keep getting some feedback on Facebook that we should look at the data with the outbreak cases separated out, and we do that internally and make decisions or recommendations based on those numbers, but we have not reported that publicly, but just to know that we do use that as part of our decision making internally. So again, we have a small number of children ages 0 to 4 that have COVID disease, less than 2%, and then we have about 12% that are adolescents from age 5 to 24, and the bulk of our cases are in people aged 25 to 64, with about 24% of them being age 65 or older. About 59% are female, 48% African American, 25% white. The presumed recovered number that we began reporting last week, when I calculated it yesterday, we had about 60% of our cases were presumed recovered. So yesterday, at the end of the week again, 59.9% were presumed recovered. We're still seeing about 15% of our cases are among healthcare workers, and around 15% are residents of long-term care facilities, and just under 8% employees of long-term care facilities. We currently have active COVID outbreaks in 9 of the long-term care facilities in Mobile County. When we look at the number of cases reported by week, again, now that we have been doing this for about 2.5 or 3 months, we have changed to reporting back all the way back to March by doing that by week, so that you can better see the trends and it reduces the noise caused by the effect of weekends. So the week starting from May 24th ending May 31st, there were 230 cases reported, and that was down from 299 the previous week. We also included the 7 and 14 day moving average. Again, this is something that we sort of fall in suit with the other public health agencies at CDC and ADPH. Again, we had been calculating and looking at this internally for discussion for many, many weeks, but we thought that it might be useful to share that with the public. to show the effect of all of the safe at home and safer at home orders that were intended to flatten the curve, and that does show that that's what has happened. We are waiting to see the effect of people starting Memorial Day weekend, particularly intentionally, apparently ignoring safer at home orders and guidance to wear a mask and stay 6 feet apart from people. It'll be interesting to see what that does in our community with regard to COVID transmission. So we also began this week reporting the number of hospitalizations and deaths by week. So we've got some feedback that we need to tidy up the language on this a little bit to make sure that it's clear. Our figures showing the number of hospitalized patients by date of admission, that is at the date of admission. So for a patient, the day that they were admitted to the hospital, we are counting them during that week. This doesn't mean that this is how many people are in the hospital this week. It just means that this is the number of people who were admitted this week. We are still looking at duration of hospital stay and those sorts of things, and we'll try to get more information added for you to see as we move forward. But we sort of just have to take these things in stages because of the resources that we have in conducting the data analysis. Also, we're showing the number of patients who died by their date of death. And the details on patients who have been hospitalized and died are still in our report by age, by sex, and by race. And again, we'll only be updating those weekly. Also this week, we just have continued to report that about 37% of patients with known hospitalizations required ICU intensive care, and around 21% required mechanical ventilation. 99 of the patients, or 85%, died in a hospital and 17 in a long-term care facility. And again, those data are through this past Saturday, not through today. So if you're trying to add things up and see how they match, these data are reported based on the closeout Saturday evening. So COVID transmission in long-term care facilities, either in employees or residents, accounts for more than 60% of all the deaths in Mobile County residents. So we still have added our map, and I'm still working with some really smart GIS professionals to continue to make improvements, so stay tuned on that. The last chart that I added is on laboratory tests. Now, you all know that I have for a really long time said that that number is really, really bad. It's just, you know, it's just messy, messy, messy. There are, you know, duplicates, misspellings of names, results that can't come in twice, people getting tested more than once. It's just messy. However, we decided to go ahead and show you the trends, because I think, as messy as it is, that the trends are helpful information. So you can see what I've been saying publicly, but here it shows in the chart that the number of tests performed has nicely, steadily gone up from the very first of our outbreak back in March through the middle of May. So for those first 60 days, week over week, we saw this really nice increase in the number of laboratory tests performed, and really that's how we could tell that the number of lab tests were not driving the increase in our case count, because our case count did not go up proportionately. We had small increases in our case count, but very large increases in the number of tests performed. So at the end of Saturday, at the close of data on Saturday, over 28,000 test results had been reported to the state lab. Back in April, on April 5th, which was the first week, we had an enormous spike due to the availability of lab tests. During that week of April 5th, 22.6% of all lab tests were positive for COVID-19. And in the past week, the week ending Saturday, only less than 9% of the tests of all laboratory tests were positive for COVID-19. So a little bit more information for you to look at, and again, if you see errors, let us know about it, because we work hard to try to expand the information that we're sharing with you, but there is a large human element in producing these reports, and humans are known to make mistakes. So please let us know if you see anything in there that looks like it might not be quite right. On the last page, I have those definitions of what a confirmed case and death means, what a probable case and death means, the definition for presumed recovered, we've talked about that before in our Facebook Live update, and then again, some information about total tested. So that came off of ADPH's website, how they kind of explain how they get that information. All right, we only have one media question today, that's great. And it says, everyone's asking the same question. How concerned am I about the crowds during protest and spread of the virus? Thanks. So it has been a really difficult weekend around the U.S. and, you know, Mobile County has been affected by the tragedy and the protests that have been going on around the U.S. And, you know, tensions are high, and we are sensitive that people are really frustrated and upset. And while we encourage peaceful protesting, it is still important that when you are gathering, that you maintain that 6-foot physical presence, wear your face covering, sanitize your hands as frequently as you can. Remember that high-touch surfaces also need sanitizing, and please don't engage in peaceful protests if you are sick. Please stay at home and maybe express your protest through social media or other outlets. I think that one of the things that we want to make sure, and this is not just strictly for Mobile, but also around the state and around the U.S., we need to make sure that our first responders and law enforcement are also listening and following the guidance about wearing face coverings and staying 6 feet apart. I know that these are incredibly challenging recommendations, but we really want people to continue to follow those safer at home measures when you're at home and also when you're out in the community. Right, I wanted to talk about a CDC article that was published last week. Last week. It's titled Evidence for Limited Early Spread of COVID-19 Within the United States, January and February 2020. There have been I've gotten a lot of questions, particularly early in the response, about did I think that we had COVID circulating during Mardi Gras. That Tuesday was February 24th or 25th, I think. And I had been saying that, no, I didn't think that was so. And I think this article somewhat lends some credibility to that hunch. It outlines the early stages of the pandemic and the first U.S. cases of non-travel related COVID-19 that were confirmed on February 26th and 28th, suggesting that community transmission was occurring by late February. These were in some pretty specific geographic areas where there is, a high throughput of international travel. So again, 4 separate lines of evidence in this report suggest that limited U.S. community transmission likely began in late January or early February after the importation from China, followed by multiple importations from Europe. Until late February, the incidence was too low to be detected by emergency department data that we call syndromic surveillance for the COVID-like illness. So there likely was transmission in some of the communities that have a large number of travelers from Europe returning and bringing it to their communities. That likely was not us. Yes, we have a lot of international travelers, but I'm sticking to my my data / hunch that we did not have widespread transmission going on during Mardi Gras. Likely, it's the evidence locally is that it started later than that.
Put that link on Facebook.
I'm sorry. Okay, thank you. So our public information officer reminded me that there is a link to that, directly to that that paper, that article on our Facebook page. Okay, two other things to chat about before I'm done here. One is Saturday clinic operation will return at the Keeler location this weekend. So the Mobile County Health Department and Family Health, the primary care division, continuing to make changes to operations. Some locations and services were temporarily suspended in response to the COVID-19 pandemic. Starting Saturday, June 6th, patients will again be seen at the Saturday clinic inside the Keeler Memorial Building at 251 North Bayou Street. The hours are from 8 to noon. Still appointment only. So you have to call 251-690-8889 to secure an appointment. And I don't know the answer to this, but is that appointment line manned on the weekend?
That one appointment would need to be made before.
Yeah, so you'll need to make the appointment during the week for the Saturday visit at the Keeler Clinic. So please call and make the appointment, but if you work 5 days a week and can't get down here for an appointment, we can see you on Saturday between 8 to noon. So call for an appointment, 251-690-8889. All right, and the last thing is today is January 1st, which means it's the official start of hurricane season. So we need to prepare for a crisis while we're experiencing a crisis. And we have released some information that came out from the Unified Command about preparing for hurricanes during the COVID-19 pandemic. This is something that our emergency management agency colleagues and our emergency preparedness staff at the health department and the city and the county have been talking about and working on. So I wanted to make a few points from this news release. During this difficult time of COVID-19 and hurricane season, please consider making alternate safe locations as your evacuation plan. Make every effort to stay with family, travel further inland, or shelter in a place only if it's safe to do so. What we're trying to do is discourage people from relying on congregate shelters during a hurricane. Because in congregate settings, we know that there is more likely, good opportunity for transmission of COVID when people cannot maintain safe distances, and instead they are congregating in a shelter situation. So what we're asking you to do is, as part of your hurricane preparedness, check all of your supplies, but also if you previously have had to evacuate from your home and relied on a shelter, please make alternate plans for sheltering, finding a place to shelter so that you can maybe stay with a family member, maybe move inland and stay at a hotel if you can for a few days, to try to find alternate locations for sheltering besides a congregate public shelter. So again, if you need to evacuate, make sure that you prepare your go kit, have personal items with you that you need for an emergency, that you can't access during an emergency, like prescriptions and other medical supplies. Include items in your go kit that protect you and others from COVID-19, such as hand sanitizer or liquid or bar soap, and 2 face coverings for everyone in your family. Also, just think about adding those things to your go kit so that if you do have to evacuate and shelter, then you will be prepared to protect yourself and your family. But again, please make every effort to shelter in place or in a safe home, maybe with family members or someplace further inland. Use a congregate shelter only as a last resort. Start thinking about this now, because there's a storm brewing in the Gulf that may gain strength any day now. So we'll keep a close eye on that and let you know if that continues and if it eventually poses a threat to our community. So that's all for today. A lot to talk through today since we made some changes in reporting overnight, and we will check in with you again tomorrow from the Mobile County Health Department. Thank you.